Hi, everyone. Welcome. I'm Dr. Samantha, the maternity mentor, here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and to answer your questions live. Give me 1 second. We might be having technical issues. Hold on 1 second. Okay, here we go. I'm going to start again. I'm Dr. Samantha, the maternity mentor, here again for one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and your chance to interact with me. You can put any of your questions into the chat and I will try to answer those live. I also try to answer the questions that you guys have put on the channel, the videos and stuff this week. Remember, we're also on Facebook and Instagram for additional content. Those get linked into the description. Remember to share the channel with your friends and family. It is really, really important to like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. And for those of you who stick around to the end, I will give you a sneak peek at tomorrow's video that's coming out, which means you should hit the notification bell when you subscribe. I'm going to go ahead and get started because we have a great question already in the chat, and I think it's a really good place to start. So I'm posting questions in case I missed it. I lost my baby due to an incompetent cervix at 24 weeks. Upon delivery, the doctor said the baby was in distress due to greenish liquid seen. What caused it? Could a dilated cervix cause the distress to the baby, or could it have been a UTI that caused, firstly, the dilation of the cervix and this greenish liquid that resulted to the comment of distress? After preterm labor, how soon can I try again if the birth was vaginal and without complications? So this is a really kind of complex question, but it's got a lot of good pieces of information. And thank you, Movie Mode, for sharing that. I'm really sorry about what happened, though that is very hard. And my heart goes out to you because a baby lost at 24 weeks is really, really difficult. So the greenish liquid that you're describing is actually amniotic fluid that's been mixed with meconium. Meconium is the first poop or stool that the baby will have. And so that's the kind of greenish, blackish, tarry poop that we are used to when a baby is born. So they start building that in their system long before you deliver. But when a baby in the belly is in distress, one of the things they will do is they will poop. And so that creates that greenish liquid. Okay. Now, what could have caused it? I noticed that you mentioned a urinary tract infection. And this is one of the reasons why I stress with infections, guys, that is really, really important to make sure you're getting treated. They're giving you the right medication. That's why I love that you guys ask those questions about medication. So urinary tract infections very likely did not cause the dilation. A urinary tract infection, though, could have caused a more systemic infection. So what I mean is that urinary tract infection could have started to be sepsis in your blood. Sepsis is a blood infection that can lead to organ failure, amongst other things. And if your blood is going septic, if you have that septic infection, that blood is going to go into the placenta and into the baby. So now the baby is potentially not doing well because they are actually sick with this infection. Now, secondarily to that, any untreated infection in general can cause a lot of issues in the body. And so all of them have a potential to put you at risk for preterm labor. So the urinary tract infection doesn't cause the dilation. It can trigger your body to go into some kind of labor, which causes dilation. And depending on what was going on with the baby, if there was a cord around the neck or something like that, those contractions could potentially have caused some of the distress. However, I would imagine that if this infection had got your blood, it was most likely just the distress of having an infection. Whatever happened, once your baby had passed, what usually ends up happening is the body then tries to deliver the baby. Your body understands that if the pregnancy is not going to be able to continue, the best thing for your life, to save your life, is to deliver the baby. And that's why your body will then oftentimes go into full-blown labor, and this could have caused the dilation. So the most likely cause of the distress at that age would probably be infection. That's my guess. Now, there could be a lot of other things. It could have been a placental issue or something like that, but most likely it was infection. Now, a lot of people after preterm labor or a miscarriage, they do want to know, when can I start trying again? So when you have a vaginal delivery without complication, that kind of depends on your healthcare provider. A lot of them will just say you can start as soon as you want to. Some will say you can wait until after you've had one period. Some will say give you like a time frame, like 6 to 8 weeks. It is very dependent on the provider and the person. I am of the opinion, which is very hard for a lot of people, and I know this, but I am of the opinion that you should probably be waiting for 2 menstrual cycles. And I do understand that that's very hard, because in the wake of losing a child, you oftentimes want to go ahead and try again. But your body does need a chance to recover. And the thing is, at 24 weeks, your uterus was starting to expand and stuff like that. And you want to give the cervix a chance to kind of recover from that delivery. So I really feel like waiting for 2 full menstrual cycles at a minimum is probably the best thing to do. Now, just because you had a dilated cervix with this pregnancy does not mean you will have one with the other pregnancies. However, it does put you at higher risk. So because of this, if you get pregnant again, they should be sending you to a maternal fetal medicine physician. Maternal fetal medicine physicians, also known as perinatologists, are the specialists who deal with high-risk pregnancies, and they really take care of everything. Because of this particular delivery, you are probably now considered high risk. That doesn't mean your pregnancy will have issues. It just means that we want to take a little bit closer look at everything. And so you really should be asking to see them as a consult so they can look at everything and make sure everything is going all right. Very likely they'll keep you coming back pretty regularly. And one of the things with the maternal fetal medicine physician is they will actually also do regular ultrasounds and stuff like that. So it's really good to make sure everything's going okay. So I hope that answered your question. Please feel free, if I didn't, to ask me to elaborate. Hi, I'm 38 plus weeks and I got my pelvis examined, and my gynecologist told me my cervix is soft and 3 to 4 inches long. What does that mean? So that's a great question. So you have your uterus, and at the bottom is your cervix, and your cervix looks kind of like this. It is long, it's thick, and it's closed. Okay, so closed means you're at 0 centimeters, and actually your fingers kind of feel like a cervix that's not ready to give birth. It kind of is the same texture. It kind of is the same look. When you feel the like the 1 centimeter is actually called fingertip, and that's what it means, is that you can stick your fingertip in. So when your mucus plug is released, that's because your cervix dilates, and this is where your mucus plug was, and it comes out. So 3 to 4 inches long means the length of the cervix is 3 to 4 inches. It's exactly what you can imagine. You took a ruler, if you could stick it in there, it's going to measure 3 to 4 inches. But what we want to eventually do is your cervix should shorten and then disappear. And that's why some women who are told they have a short cervix are monitored more carefully for preterm birth, because 3 to 4 inches of cervix versus 1 inch of cervix, that's a big difference in dilation. And this is what I mean. This is your cervix. As you have contractions, your cervix is going to start to dilate, right? And it's also effacing. So effacing is going from thick to thin, okay? And at 100% effacement, it's like as thin as a sheet of paper. It's just barely there. And what you are also doing, you're effaced and you're dilating, okay? So thick to short to thin to dilation. And it's kind of all happening at the same time, but that's the roughest way I can describe it. So 3 to 4 inches long has to go from that shorter. Okay. Now, cervix is soft. Your cervix actually kind of feels like your fingers. It's pretty firm. Okay. So what we need for a cervix to be able to dilate is a soft cervix or a ripe cervix, because when it's very like stiff, it means the cervix isn't ready to deliver, and you can't just pry it apart. You need it soft to be able to do that dilation and effacement. So soft simply means the cervix is kind of in ready mode, but 3 to 4 inches long means your cervix hasn't effaced yet. You're still kind of in that limbo stage, but it sounds like it's going to be happening like sooner than you think. And if you're having a lot of Braxton Hicks contractions, now that your cervix is soft, the Braxton Hicks contractions help to dilate you further. And then the other thing I'll tell you is if they stripped your membranes today, and I have a video on that, but if they stripped your membranes, which is where they take their fingers and they go up on the side of the amniotic sac to release the membrane that's there, that releases prostaglandins. And prostaglandins are hormones that tell your body to go ahead and have a baby. So oftentimes, if they've done that, especially with your cervix, which is kind of like ready, you can actually potentially go into labor sooner. So that is my answer. Please feel free to ask me any more questions that you have about that. Please feel free to put your questions into the chat. I'm going to go ahead and answer some of the questions that we had. I'm 10 weeks pregnant and having light bleeding. What should I do? Okay. So number one, if you are having an issue, call your healthcare provider. And I know that sounds like a bogus, like cop-out answer, but I promise you it's not. The thing is, from working in labor and delivery and places like that, I can't tell you how many women will come in and they're like, I don't know if I should have. I didn't call the doctor. I'm not sure, because they feel like embarrassed, or they feel like they're being a pain if they're calling and asking questions. And really, you need to understand your healthcare providers signed up for that job. Okay. They signed up to be on call 24 hours a day, 7 days a week, because you never know when a baby's going to be born. And they're there. If you're concerned, you need to call them and ask your questions. And it's very important, because in the first trimester, a lot of the bleeding can be very normal, but you could have bleeding that was normal one week and abnormal the other week, because they're two different causes. But once you get into second and third trimester, we don't want to see any kind of bleeding, not really even spotting. And so that's why it's really important to call them. But you have every right to call them at any time of the day or night. It is better to let them know what's going on and ask questions than to not say anything at all. And a lot of times they are going to do an examination, which in the early parts of your pregnancy is an ultrasound, to check and see what's going on, to see, is there a placenta problem? Do you have an infection? Okay, remember, infection can cause bleeding amongst other things. Are you dilating? Do you have a subchorionic hemorrhage, which we have a video on, and it's a type of placental issue. So they're going to check all of that, because each one of those causes has a different plan of care, right? And so that's what's really important about it. Now, at 10 weeks pregnant, there are a lot of potential causes, like I said. And so what you need to do first is to call the doctor and let him know what that bleeding looks like. When did it start? What's going on? And letting them know what it looks like. It's not only quantity, but the color of it, because the color truly matters. Pink means it's blood mixing with some other kind of fluid. And there's lots of fluids that can come from a vagina. Red, bright red, or like a ruby red, that means you have an active bleed going on. That is very, very important to know. Brown means it's probably resolving blood. Okay. It's an old bleed and you're just getting rid of the old blood. And why is it some of this important, right? So let's say it's 2:00 in the morning and you're bleeding. Well, you call up your doctor and you have brown blood. They are very likely going to say to you, it's okay. It's brown blood. That's old blood. You're probably not bleeding. Call the office in the morning and tell them I said to come in for an exam, right? Let's say it's light pink spotting, like little drops, and it's very like pink. They might say to you, hey, did you just have sex? do you feel like you have an infection? Just keep an eye on it. If it gets worse, go to the hospital. But otherwise, call my office in the morning and tell them I want you to come in because it's just light pink. But then that red, they're very likely to take that a little bit more seriously because it's an active bleed. That's why the color is important. And they may say to you, no, I want you to go to the hospital so they can do an ultrasound to see what's going on. And so you see how knowing what the color is and then the quantity is very important also. Now, quantity is really hard. It's always been hard. You can find pictures on the internet, which shows you like a pad, but you get down to it and it's very confusing. So honestly, in today's day and age where we have all these cell phones right at our disposal that have a camera, I encourage people to just take a picture of their pad, okay? Because we've seen it all. We're not going to get grossed out by a picture of a pad. But if you show it to us like that, then we can see what the quantity is. We can teach you what the quantity is, and it gives us data, okay? It is important if you see any bleeding, including spotting, guys, any bit of bleeding, old blood, new blood, anything, you want to put on a pad immediately. So one of the menstrual pads, right? Immediately, because that gives us the visual. Okay. If you're just bleeding and you wipe blood or you see it on your underwear, that does not give us the data we need. But once we have a pad that we can look at, it's a lot easier to determine the true color and the quantity. Okay. So every pregnant woman should have pads in their actual office or in their actual home when they're pregnant. Sorry, guys. I looked weird for a second because YouTube gave me a notice that the chat was disconnected, but it says it's reconnected. So let me know if you guys are seeing it. Oh, my producer just put in a test and I can see it. So that's good. So getting pads and keeping them are very, very, very good. Okay. That's a really good thing. If you are pregnant and you're bleeding, do not use a tampon. Hopefully a lot of women know by now that tampons need to be removed regularly. You're not supposed to leave them in for a long time because it can cause toxic shock syndrome. So you do not want to keep a tampon in the vagina because what it's doing is it's absorbing some of the natural vaginal bacteria and it's just keeping it there and it's stopping up everything that's in the vagina. And that can lead to a potential infection. And of course, if you're pregnant, we don't want an infection. And then secondary to that, let's pretend that didn't happen. Well, on a tampon, we cannot tell what your quantity of bleeding is. Okay. So that's why you don't want to, you just want to use a pad. So it's very important to get that checked out. And especially because you might have an infection. Feel free to put any of your questions into the chat. I'm answering another question from the videos. It says, and this was a good scenario. So it says, I'm sorry I'm late, but I'm on the birth control pill and I don't have a doctor. I'm 17 and my dad is struggling because we have 5 kids in the house. I'm on the pill and I had my period 3 weeks ago, which was normal. Then a week after my period, I started having brown spotting with brown clots for 5 days. 6 days later, I'm having spotting with clots again. I want to see a doctor, but we don't have insurance and I'm scared to talk to people about it. I've been feeling sick every day with cramps in my lower stomach, headaches here and there, and back pain. The smell of bread makes me want to get sick. I don't know what's going on, and I've been trying to find answers. If it's serious, I'm going to save up the money to get it looked at. So this was a very brave, very detailed question that I thought was really, really, really so honest and so wonderful that this person was willing to share this question. So let's start with a couple of things. If you are getting your regular period and you are bleeding, you can still be pregnant. Okay. That's number one. So you can be pregnant and your body might not quite have gotten the signal yet. And what it'll do is you can actually bleed. That's one of the reasons why in the first trimester you can bleed and the pregnancy is still fine. How do you guys check to see if you're pregnant? Okay. So a lot of people don't realize this, but the dollar store pregnancy tests are actually amazingly accurate and they're cheap. Okay. So if you are not sure, always go to the dollar store to grab a pregnancy test. That is like seriously the fastest, cheapest way to do it. Because all these pregnancy tests are doing at this point is measuring HCG, which is human chorionic gonadotropin. And so HCG is the hormone that we are looking for both in the urine and the blood to tell us that you're pregnant. Fastest, quickest way. It's really important to determine if you are pregnant, because if you're not pregnant, what else could be causing this? So now we're going to go to birth control pills because, everything on this channel is not always just about being pregnant. It's about women's health also. So with birth control pills, a lot of people don't realize this, but you have to be really careful with them. So for starters, most antibiotics interfere with your birth control pill and it will make it not work. You will actually not be protected from having a pregnancy or a baby. A lot of the mood stabilizers / epilepsy medications, those also interfere with birth control. And that's just the start of many, many meds that can do that. So the first thing is if you've been given a med and then you're not having protected sex, you can actually get pregnant. So anybody who's adding a medication to your body, you need to ask your pharmacist, does this interact with my birth control pill? Because I don't want to get pregnant. Do I need to use alternative methods like condoms or something? Now, the second thing is a lot of people don't realize, but if you have diarrhea, sorry, I was looking for the word. If you have diarrhea and you are taking a birth control pill, potentially depending on the timing of when you took the birth control pill, that can actually also make sorry, I'm thinking about it. That can also make the birth control pill ineffective. And if you think about it, it makes sense because what's happening is your GI tract is like racing food through. That's what diarrhea is. You're just racing stuff through. So you don't absorb things properly. And so as a result, your hormonal birth control may not be absorbed. A good way to protect yourself from pregnancy without these issues is an IUD, the intrauterine device. And these are little pieces, they're like a little plastic tee that goes inside the cervix, and that can actually prevent pregnancy. There's a hormonal version and there's a copper version, but both of these are not affected by stuff like the antibiotics and stuff. They're also safe. Now, as far as going from here with healthcare. So if you're bleeding while you're taking birth control pills, there is a chance of what's going on. And so what can happen is you need to kind of look at the whole picture. So it could be because you're not taking the birth control pill regularly or at the same time. So there are some women who are so lucky, they can take a birth control pill in the morning and they can take one the next day at the night and they can skip one and then they can go back and they're totally protected from pregnancy. There are people like that. Do I recommend that? No, you need to take your birth control kind of consistently and at the same time of day. But you can have, you can have some people who, if they don't take their birth control pill at the same time, exactly, they are actually at risk for getting pregnant. Usually those people can actually feel withdrawal effects the next day when they are supposed to be taking their pill. They actually will have mood issues and stuff like that. So it's one of those things that you got to be careful with, but it's possible that it will potentially be a problem. So once you're bleeding in between, we need to figure out what's going on. Abnormal bleeding is usually looked at as a potential issue, and we usually do an ultrasound to see what's the issue. But when you're talking about somebody who doesn't have health insurance, doesn't have the money for a provider, at least here in the US, there's a lot of places you can go, like Planned Parenthood. Planned Parenthood a lot of people don't realize because it gets a really bad reputation in the community for a controversial issue that I'm just not going to talk about. But Planned Parenthood does like so much more, like incredible amounts more. One of the things Planned Parenthood does is reproductive care. They actually will go ahead and do GYN exams, and they will do pap smears and infections. They will ensure a woman's reproductive system is healthy. And if you don't have money, they oftentimes do this like at no charge because they are trying to make sure you stay healthy. They oftentimes will also provide birth control in the form of condoms for free because, as we all know, or hopefully you guys know, birth control pills protect you from pregnancy. They do not protect you from sexually transmitted diseases, which is why you all should be using condoms. I know it's not sexy, but that's what should be happening. So Planned Parenthood and other clinics like this can actually provide you the care and check to see what's going on without any cost to you. So can I talk more about mood stabilizers and how they affect birth control? So basically what the mood stabilizers are doing is they usually are they're affecting the hormonal content of the birth control pill. So they kind of like destabilize the like the quantity of it, and there's no rhyme or reason to like exactly how it's going to happen. It's not like they completely get rid of estrogen, for example, because mood stabilizers also affect progesterone only birth control. It can affect high estrogen content and low estrogen content birth control. So what it is, each one of these birth control pills are very carefully formulated. So they have like the reason why their names are all confusing is because they all use different tiny molecules of all these hormones at different tiny amounts. And they put together this combo that's exactly perfectly theirs, that company's birth control. It is then tested extensively. But if you have anything that will disrupt how you metabolize that, whether it makes you run through it faster. So going into a little bit deeper, if you're a fast metabolizer, guys, that means you're just burning through medication. People who are a fast metabolizer, they actually need more medication. These are the people that need a higher dose. People who are slow metabolizers, they take forever to burn through medication. So they need less medication, and actually regular doses can actually be toxic for them. So then going back to the mood stabilizer, if the mood stabilizer is already affecting the hormonal content a little bit, which means now it's not to the manufacturer's spec, and it increases your metabolism, and they're all different, like it's different combos. If it increases your metabolism, you're burning through it fast at a hormonal like levels that weren't like tested for it, ineffective. And that's ultimately why it's that. Antibiotics, same thing. There's a lot of different like supplements that can affect your like estrogen levels, your testosterone levels. Those are at risk for also making birth control ineffective. But it basically has to do with metabolism and breaking up the chemical structure. And then it's not a guarantee. That is one thing you guys should know. It's not a guarantee, but it's happened. And like one of the examples is Lamictal, which is also a mood stabilizer, actually does not interfere with birth control. So for women that need a mood stabilizer and they need to take birth control, we actually will try to do Lamictal. With Lamictal, the actual reverse happens. Birth control pills increase Lamictal in your system. So it's a funny like cocktail of chemicals that kind of bring this all together. So I hope that answered your question, but if it didn't, please feel free to elaborate. Okay. So I had a question on my Polyhydramnios video, and this was like really good because it had a lot of stuff in it. Is 23 centimeters of fluid considered too much amniotic fluid? My doctor told me it's due to my increase in carb and sugar intake over the last month. I've started craving sweets in the third trimester. I'm currently 34 weeks with 23 centimeters of fluid. They have me cutting my carbohydrate sugar intake back and coming back in 2 weeks to check the fluid. I don't have gestational diabetes, but I'm anemic, have a low-lying placenta, and vitamin D deficiency. Can you give any reassuring tips? Okay, so you're welcome, Jess. So polyhydramnios is when you have too much fluid. It's when there's too much in your belly. Polyhydramnios is a very serious condition that you can develop towards the end of your pregnancy. The reason why it's serious is if you have too much fluid, first of all, you can go into preterm labor because at some point in time, you can't hold any more fluid. And so your body's like, nope, we got to deliver. And oftentimes that delivery starts actually with the rupture of membranes or your water breaking. Now, somebody who has polyhydramnios, because you have so much fluid, what happens is the baby floats a little bit. So at the end of your pregnancy, your baby is running out of room, right? So as they're running out of room, their head sits on your cervix. So when you're having these contractions with that nice soft cervix, the head is putting pressure, which also helps with dilation. But when you have polyhydramnios, the baby is actually got a little bit more fluid because there's a little bit more of a cushion. And so the baby will actually float. They won't sit firmly on the cervix. When your water breaks, when you have polyhydramnios, the risk is the umbilical cord can actually go down first and the baby's head on top of it. The umbilical cord is the lifeline to the baby. This is where the the blood and the oxygen and the nutrients are all exchanging back and forth between mom and baby. If the head comes down onto the the umbilical cord, it can compress it. And if it squeezes it too tight, it can actually cause suffocation. But the thing is, with the head on top, there's nothing to do with that. So it's considered a medical emergency. So with polyhydramnios, we monitor these women very carefully. And towards the end of your pregnancy, we may actually bring you in and have you stay in the hospital so that we can do the emergency stuff that we need to do if you ended up rupturing and you had what it's called is a cord prolapse. And honestly, what we do, guys, is we stick our hand in and we push the baby's head up, and whoever's hand is in there stays in there while you have a C-section. And it is actually that. Their nurses have to actually sit under a surgical drape for 20, 30 minutes to push that head up to save the baby's life. And one of the nurses that I used to work with actually had that happen with one of her babies. And it was another nurse we worked with who was the one who actually was in the operating room holding the baby up. So we have options, but that's the biggest risk with polyhydramnios. Now, sugar. Polyhydramnios is often caused by diabetes. That's a very big cause for it. One of the other causes is actually kidney issues with the baby. If your baby has some kidney issues, which are usually found at 20 weeks, during the anatomy scan, the kidneys are what helps to make the fluid that the baby's sitting in. Your baby actually pees throughout the pregnancy, and that's part of the amniotic fluid. So if the kidneys aren't working right, you can have too little or too much fluid. So that's one of the causes. But the second cause is diabetes. This is a very big cause of polyhydramnios. And so that's why your doctor is telling you to cut back sugar. So just so you guys know, you have that glucose tolerance test. For anybody who doesn't know, most people will have a glucose tolerance test for diabetes at about like 24 to 28 weeks. It just depends. And this is where you actually drink this sugary drink and they test your blood to see what your sugar is. If it's too high, that could be gestational diabetes. There's a little bit of a back and forth on whether they're going to change the criteria. So it used to be in the past that you did that and you did it for 3 hours and you had to fail 2 of those sugars to be diagnosed. Now they're talking about if you just fail 1, if you just do a 1 hour and you fail, that's it. We're going to call you diabetic because diabetes has a very serious side effects and potentially huge risks in your pregnancy. Now, once you pass that at 24 weeks, especially when you're getting into the 32, 34, 36 week area, if you are looking like you might have diabetes, they will probably not test you again. You're so close to the end, it's just irrelevant. At that point in time, they are wanting you to just cut back on sugar to try to help prevent those complications. So what I would tell you is you may not have had diabetes at the 24-week glucose tolerance test, but if you haven't been tested again, you absolutely could have diabetes at 34 weeks. That can happen. Just like you might not have blood pressure and then you develop high blood pressure. So these are things that can develop, which is why they're wanting you to cut back on your carbs. Now, let's talk about the pocket, the like measurement. So they basically, when they're going ahead and they're doing your ultrasound to determine polyhydramnios, they're looking for the deepest pocket. That's like the largest pocket. Some people just take the biggest number and that's the number. Some people take the average of 3. I've seen it both ways. But they're basically literally measuring. They're seeing like your baby and they're seeing areas where it's just fluid and they're measuring that. Okay. Now, I've worked in an antepartum unit where we had pregnant women who were having complications who stayed with us in the hospital for a long time sometimes because we were monitoring them and the baby to try to prevent complications. And a lot of those women, especially the ones with polyhydramnios, we were doing ultrasounds every day. And guys, just so you know, one day you can have polyhydramnios and the next day you might not. Your amniotic fluid changes every day. And then remember, it's the biggest pocket they can see. So if the baby's position shifts a little bit, you might actually see a big pocket today and not as much of a big pocket tomorrow. So your fluid is always variable. So that's probably part of the reason why they're not trying to give you an ultrasound every day, but in 2 weeks coming back to check you again is like a big deal. Is 23, the number 23 now a big deal? Anything over 20 is usually something that we're keeping an eye on. But I will tell you that if they were seriously concerned, like really like your life is in danger right now, or baby's life is in danger right now, they would have admitted you into the hospital. Most hospitals nowadays have some place for pregnant women who are having complications to be monitored, because unfortunately women are having more and more complications during pregnancy. Now, she also mentioned low-lying placenta, anemia, and vitamin D deficiency. So low-lying placenta, nothing to do with polyhydramnios, but just for anybody who doesn't know what that is. So you have your cervix, you have the placenta, which is the organ that feeds the baby through the umbilical cord. So this is a placenta previa. This is a complete previa. This is where the placenta is completely over the cervix. If you have that, it's an automatic C-section. There is no other delivery, because once you start to dilate, all of this is open blood. You're going to bleed out and you and the baby can pass away from hemorrhage. A partial previa is basically, instead of this, it's like partially on. That is also an automatic C-section. Low-lying, though, is a placenta that's like right here. So it's right to the side of it. It's not on over top. And so low-lying placentas, that just means they're near the cervix. But because they're not over it in any way, a lot of times you can have a vaginal birth. But it is something we want to monitor. Now, low-lying placentas can migrate. So a lot of times you'll have a low-lying placenta at the beginning of your pregnancy, and it moves as the uterus expands. So it can actually move up. So low-lying placentas can also kind of change position. What I can tell you is you don't go from a low-lying or like a normal placental position to like a complete previa. That really doesn't happen. So that's all that is. They're telling you because a low-lying placenta is not considered normal. So they're mentioning that. Anemia and vitamin D deficiency. Oh, guys, this is the worst. And I'm seeing it all the time. And it's so detrimental to your health. So vitamin D does a lot more in your body than bones. That's all we've heard about for years and years and years. Vitamin D helps produce some of the most powerful neurotransmitters. These are chemicals in the brain that moderate, amongst other things, your mood. And they're really important for your body. Vitamin D helps your immunity. It helps to boost your immune system. Vitamin D is essential for energy and for metabolism. It does so many things. And vitamin D deficiency is rampant. Vitamin D deficiency in pregnancy can also lead to nightmares. Believe it or not, nightmares are actually pretty common during pregnancy. A lot of people don't realize that. A lot of times they'll happen in the second trimester, that a woman will start to have these nightmares or very vivid, strange dreams. And the two most common causes of that are anemia and vitamin D deficiency. Those two things can also cause restless legs or restless leg syndrome, especially during pregnancy. So women will often have these things that they never had before and they'll never have again, but they are interrupting their sleep, which is just horrible. So vitamin D deficiency needs to be treated and treated effectively. There's a lot of studies and stuff going on nowadays about whether vitamin D deficiency contributes to miscarriage. I've heard providers go back and forth. I just think if you are going to be pregnant, your body needs to be in optimal, optimal nutrition. And if it's not, you are at risk. And we do know, for example, that if you don't take enough calcium when you are pregnant, so we have a video on prenatal vitamins, but what you're going to find out in that video is that you actually need to take extra calcium because your body will strip calcium out of your bones if you don't. Okay. So if you imagine that, it's very likely your body is using up other stores for the baby to make sure the baby is healthy. So it's stripping you down even further. I have taken care of women who've had severe vitamin D deficiency and ended up having a miscarriage. And then we've had to go ahead and adjust that and fix that. Anemia. So anemia is extremely important for the whole functioning of our bodies. So anemia is basically when your body is not transporting the molecules that you need to the rest of the tissues. Like oxygen is the big thing. Red blood cells carry oxygen that gets to your tissues, and then they carry out carbon dioxide back to the lungs. And so when you're anemic, you oftentimes don't have enough red blood cells, and your hemoglobin and hematocrit, which are measures of that, are low. On the back end, you can also have iron deficiency and ferritin deficiency, which can cause a different type of anemia that they often don't recognize. Anemia is also a serious issue when you're going into birth because during labor, you are going to lose blood. Now, vaginal births are usually less. C-sections are usually a little bit more, but you're already at risk for a hemorrhage after you give birth. And so having anemia on top of that can put you in a life-threatening position because you need those cells in order to keep your body alive. It's transporting oxygen. So when you have anemia, you need to make sure it's getting treated. So the anemia and the vitamin D deficiency, I don't believe is causing the polyhydramnios either. However, they really should be addressed, especially the anemia. If you're 34 weeks pregnant, hold on, let me see. I forgot. 34 weeks pregnant. If you're 34 weeks pregnant, you're approaching delivery at any time. And being anemic going into that delivery puts you at high risk for issues postpartum, for big postpartum complications. So I hope that answered the question. Any of you guys who have any questions, please feel free to put them into the chat. So I got a couple questions on the superfoods video. So as I just said, nutrition is one of the most important things that we have. Our body needs to be in optimal condition. So it says, I am 4 months pregnant. What is a mother supposed to eat when she's pregnant? And one of the other questions was, how many eggs can I eat in a day? So eggs, you can eat however much you want to eat. But really, in an ideal world, you're eating a whole balanced diet, which is kind of the answer to the second question. You want to eat a balanced diet that's full of nutrient-dense foods, okay? This is the key words, nutrient-dense foods. And so it's important for you guys to understand what you're putting into your body. So I had a patient who came to me who was told that she needed to eat lower carb, lower sugar because she was at risk for diabetes. So she was told to eat Greek yogurt. And so I had her, while we were in our appointment, because it was virtual, grab her Greek yogurt out of her refrigerator and look on the back. And lo and behold, it had 23 grams of carbs, which is more than a lot of people eat in the keto diet, which I also have a video on. So that is actually full of sugar. That yogurt was not really nutrient dense. Nutrient dense foods are foods that contain a whole bunch of different vitamins and minerals in them. And they usually are basically your meats, all of the animal meats. They are all of the vegetables. They are all of the fruits. These are all things that are nutrient dense. Now, we also have some foods that are not as healthy for you, but definitely can provide some of the nutrients that you need, which is like breads, which are enriched, as well as cereals, which are enriched. But to be honest, guys, those are just basically sugar, to be very honest. So you're looking for all those foods that are just whole, like you could pick them off a tree or dig them out of the ground, or are provided by an animal. And all of those contains a lot of different things. So like eggs contain so many different nutrients in that one little egg. They're very good for you. But that's the most important thing. And every little bang for your buck that you can do is important. Now, hyperemesis gravidarum, which is severe morning sickness, is oftentimes a really big challenge when you have it, because you're trying to get your nutrients in and you're like, what do I do? So smoothies are a fantastic way to deal with getting that whole nutrient dense food in and still being able to manage the fact that you have hyperemesis. So the reason why a smoothie is so brilliant is because, first of all, you can just blend up as much as you can. And oftentimes you can cover it up with a flavor that doesn't make you sick. Second thing is, cold tends to be better on the stomach than warm when you have like morning sickness. It just tends to be a little bit better. And third, one of the biggest ways to help with morning sickness is to eat small meals. So your doctor will say, or your healthcare provider will say, take small meals, eat like 8 times a day, do little snacks. Like they're all saying that, because if you expand your stomach too much, you're just going to want to throw up. A smoothie, you can take little tiny sips all day long. Every minute, 2 minutes, 7 minutes, you can take a little sip, and each one of these sips is full of lots of good nutrients that is good for you and the baby. So ultimately, it's whole natural foods. That's your number one. I have one more question. So if you guys have any questions, please feel free to put them into the chat, and then I'm going to give you a sneak peek at tomorrow's video. So the last question was, hi, my pharmacist gave me Canistan cream. Is it safe for a yeast infection? So this is a great question. So let's start with infections. If you were suspecting an infection, if you have a weird smell from your vagina, if you have some like kind of discharge, anything like that, you need to get it checked out. What do we do to identify that? Sure, we can look at it and kind of get an idea. If you look at my STD videos, one of them is bacterial vaginosis. That is a very distinct look to the discharge. It has a very distinct smell. So we can kind of look at it and see, but really the definitive thing is to take a sample. So what we do is we do a vaginal exam, and we take a sterile swab, and we'll swab the inside of your vagina to get some of that fluid, and we send it to a lab. We can tell if it's urine. We can tell if it's semen. We can tell if it's normal vaginal like flora. We can tell if it's a virus, a bacteria, or a fungus yeast. Okay. So we can tell all of that. That's important because, guys, an antibiotic does not treat a virus. Those two things don't match. An antibiotic does not treat a yeast infection. In fact, it will make it worse. So knowing what we're dealing with is extremely important. Okay, so now we know what it is. So now you need to get the right medication, as I just described. Yeast infections are very common. They can lead to preterm birth. Okay, that is possible. So when you're talking about yeast infections, the thing is, most of us are actually used to seeing all the yeast infection products right on the shelf. Like they're right there. And so it's very important. You cannot just pick things up off of the shelf or the counter because it's there. Just because it's there does not mean it's safe for pregnancy. A great example, some of the antacids are safe for pregnancy and some are not. So that's one example of many. So Now you have the different yeast medications. So Canesten is also called clometrazole, which I'll get more into its safety. But clometrazole is safe for pregnancy, but it comes in different forms. So this is actually what you need to know about this particular one. Canesten is probably safe if taken orally. That means in a tablet. And it's actually safer if it's taken topically or vaginally. And so that's the thing. When you're talking about medication, there's also this bit of absorption, and things get absorbed differently and at different rates depending on how you take them. So it's very important to understand that, because different forms can actually be safer or not safer. The other thing is, if you're at high risk for a potential infection, your healthcare provider may not want you to, for example, use any of the suppositories. The suppositories are like a little kind of capsule, and you have to insert them in. Sometimes they don't want you to use those. So it's one of those things that you really do need to talk to your healthcare provider. Now, you get the med. You're not sure if it's safe. I get tons of questions about this. And I'm saying to you it's safe. Like, how do I know this? So all of us healthcare providers, we have access to a lot of different places which give us data about the safety of medications. What you got to understand is we cannot test medications on pregnant women. We cannot test medications on breastfeeding women, because it puts the baby at risk. So it's not ethical to do that. So instead, what we have to do is gather a whole bunch of different data. We have to gather the safety profile of the medication when you're not pregnant, the half-life, the molecule size. Is it fat soluble or water soluble? Then we have to also gather animal studies. And then we also gather data from other people, other women or that have taken these medications during their pregnancy and what happened with them. There's a lot of databases out there where, with a patient's permission, you can actually submit what happened during their pregnancy if they were taking a medication. So, for example, a good medication right now is Lamictal. Lamictal is the only mood stabilizer that we believe a woman can take during pregnancy. For the longest time, it was thought that all mood stabilizers were unsafe, but now it looks like Lamictal might be, and that's from them being able to aggregate data from women being willing to put their name into these databases, which are HIPAA compliant, but they're accessible to the researchers. So we gather all of that into sources. One of the sources I use is Infant and Risk Line. It's Thomas Hale. He's a pharmacist who's kind of put together all this stuff and created a safety scale. He's a safety scale for pregnancy and a safety scale for lactation. And then he takes that to give a kind of risk versus benefit type of scenario. So with clometrazole, that's where I'm getting that it's probably safe or safer. When you don't have me or my book, right? And my book is actually accessible. You can actually call the Infant Risk Line and ask questions. They will actually answer questions. If that's not available to you, your local pharmacist is also another expert. So pharmacists have specialized training for medicating women who are pregnant and breastfeeding. They have databases and computer systems to access to help with the safety and efficacy of these medications. So if your doctor has prescribed something to you and you're not sure if that's safe, that is another option. So we have come to the end. For those of you who stuck around, if you guys checked it out last week, we did a video on actually how to interview a pediatrician, the questions that you need to ask. This week, our video is going to be, how do you choose the pediatrician to interview? So this video is going to tell you what to look for in a pediatric practice and how you even know that you want to go to the next step of actually interviewing that pediatrician, because it's such an important decision for your family. So I hope you check it out. I'm Dr. Samantha, the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as any questions you put onto the videos. Please like and subscribe. Please, please, please. It is very important as a content creator. YouTube wants to see that we're getting subscribers, so I really appreciate that support. If you like what you're hearing, please subscribe. Share the channel with your friends and family. Tell all of them to subscribe, because this will allow me to keep coming to you and doing this for you, which is really just so much fun and so fulfilling for me. I'm really happy to be able to help you guys. We're also on Facebook and Instagram for additional content, so please check those out. I am Dr. Samantha, the Maternity Mentor. I appreciate all of you guys. Have a wonderful evening. Bye for now.